Good morning. My name is Dr. Richard Lynn. I'm a surgical oncologist. I do general and vascular surgery with a major emphasis on surgical oncology. And I've been asked to speak a little bit about why I feel very passionate about gamma surgery and the company and the service that they provide, most important of all to my patients. Where have I found gamma surgery to be so important in my practice? It's first and foremost the dependable, reliable, reproducible, day in, day out accuracy of knowing that I am going to the operating theater with the best, most accurate information that can be provided to my patients. In my office, when we book the case, it doesn't even require now calling gamma surgery. The hospital, I book it with sentinel lymph node investigation. They know that I use gamma surgery. They call, gamma surgery is there 3 hours ahead of time. They go to nuclear medicine. They're involved in the injection. They're involved in the lymphoscintigraphy. They're involved in the mapping, not just the nuclear medicine tech who may be a per diem coming from someplace who has no track record and therefore no accountability. Then that patient is marked by the gamma surgery technologist. In this particular case, somebody who I've worked with now for quite a few years under Leon DeGalli, traced it out so that there was one area just infraauricular, one area submandibular, and one area in the posterior sternocleidomastoid location. In fact, the patient questioned whether or not she was doing her right job because she wasn't looking at x-rays, she was just doing this with the gamma probe. I reassured him that that was the case. We took the patient then into the operating room, so this is now 3.5 hours after the situation. Patient's put to sleep. I then injected as a belt and suspenders, because I do believe, and gamma surgery would be the first to tell you that lymphoserin blue or methylene blue is a adjunct, and it's a belt and suspenders, but certainly the gamma surgery part can be done without that, and people feel, Armand Giuliani, that it can be done without the gamma probe, but the data clearly shows that the two together give even more accuracy and sensitivity and specificity. We then plotted out, again in the operating, because with positioning it can move a little bit, and she was within a millimeter of the three places that she marked. All three were within a millimeter of where she marked it, and through one incision I was able to retrieve all the nodes. In summary, I'm not making any money for this speech, and they're entitled to make a few dollars, just like all of us, in doing the right thing. And I can tell you wholeheartedly that gamma surgery is something that I feel can be a tremendous asset to your institution if it's not already there. And if you have that teamwork, then the most important person to benefit from it is the patient. Thank you very much for your time. If you have any questions at all, I'm sure gamma surgery can give you my number, and I'd be happy to tell you how we utilize it here in my